So today we're going to be talking about the side effects and the risk factors associated with using intrauterine contraception. Now, the hormonal side effects include acne, breast tenderness, headache, and even mood swings. Now, in using intrauterine contraception, there are risks associated as well. One of the risks include developing a pelvic infection. This usually happens within the first 3 weeks of insertion. Another risk associated with it is that it can be misplaced in the womb, and if it's misplaced, sometimes it can even puncture the womb, and if it punctures the womb, it can lead to what we call uterine perforation, which can in turn lead to pelvic pain and even bleeding. Finally, another risk that has been found is decreased libido or sex drive. Those are some of the common risks and side effects associated with the intrauterine contraception. Talking about the side effects and risks of using the combined hormonal contraceptives. Now, for the side effects, they include bloating, nausea, abdominal pain, breast tenderness, and headache. Now, for the risk factors, there are quite a few risks associated with the combined hormonal contraceptive, although these risks are very minute, but it's important to be noted. Number one, it's an increased risk of developing a blood clot. People who take combined hormonal contraceptive have a higher risk than the average person who doesn't. Another risk is an increased risk of breast cancer. However, upon stopping the combined hormonal contraception, this risk is reversed within 10 years. Number 3 is an increased risk of cervical cancer. And number 4 is an increased risk of depression or depressed mood. So these are things we highlight to our patients before offering this contraceptive option. Now, a lot of people tend to talk about weight gain when it comes to the contraception. There is no evidence, and even speaking from personal experience, that combined contraceptive causes weight gain. So in this video, we're going to be talking about people who should avoid the combined hormonal contraception at all costs because it causes more harm than good to you. Number 1, if you suffer from severe migraines, you should avoid it. Number 2, if you or a family member has had a blood clot below the age of 45. Number 3, if you've had a stroke. Number 4, if you've had breast cancer in the past or have an immediate family member, be it your mom, sister, or auntie that has had breast cancer in the past. Number 5, if you're very overweight. Number 6, if you're a smoker and you're aged 35 or older, or if you stopped smoking less than a year ago and you're age 35 or older. Number 7, if you have any heart conditions, heart abnormalities, or any disease relating to the heart, such as hypertension. These are the people who should avoid the combined hormonal contraception at all costs. We're going to be talking about the side effects and the risk associated with progestogen-only contraception. Now, in terms of the hormonal side effects, one of it is this irregular periods. Some people even experience prolonged bleeding, whereas some people don't even bleed at all for months at a time. Some people, however, experience spotting throughout their time under contraception. Now, some of the risks involved with progestogen-only contraception is the chances of developing an ectopic pregnancy. Very small chance, very small risk, but the risk is there. Number 2 is increased libido, actually. 3 is the risk of developing ovarian cysts. Number 4 is weight changes, actually. It is the one sort of contraception that is associated with your weight changing. Finally, it's also been found that it can affect your mood and even cause depression. So that has brought us to the end of our contraceptive talk. I hope you learned 1 or 2 things. If you have any more questions, please leave it in the comments below. Thanks.